High risk pregnancy, we define it as actually the pregnancy which causes problem to the mother and the child both, and that is known as high risk pregnancy. It is very simple. All pregnancies are good pregnancies, but when it comes to the high risk pregnancy, the mother, there is every possibility of the mother and child to be in a danger zone. Every pregnancy, when we follow up the patient when pregnancy, so signs and symptoms mainly depends on the advancement of the pregnancy. In every term, there is a, if the nausea and vomiting is more, then we know that there is something, some problem is there. And if there is a headache in the pregnancy, then we think of about the hypertension things. And if the sugar level is more, then again we should have a regular checkup for that also, and we can detect a high risk pregnancy in those cases. Or there is any blood disorders which is present in the family or in the pregnancy also, then we think of it as that it will be a high risk pregnancy. High risk pregnancy, suppose there is a first and foremost is if the age factor is more than 35 years of age, or if a girl is pregnant less than 17 years of age, then again it will be considered as a high risk pregnancy. Or else any existing disease, if it is there in the mother, like a kidney disease or hypertension or diabetes or thyroid or autoimmune disease, any such conditions which will increases the risk in pregnancy, that is the factors actually. So high risk pregnancy is a different chapter in our branch in obstetrics actually, and we have to have a very close monitoring of the patient. So as if we know that there is some existent disease in the patient, then we take care of the patient every 15 days or 20 days, for regular checkup. That is one of the criteria. Or each and every checkup, monthly checkup in obstetric, we should always look out for the things that it is happening with the existing disease. Or else we have to have a very close monitoring about the blood pressures, and they should also have a blood pressure at their home also at the same time. Or if they have a family history of diabetes also, they should check regularly the diabetic glucose level of the patient, in their house also, and inform the doctor. So it is basically a relationship between the doctor and the patient which brings into a good outcome in the pregnancy. That is all we do. And then finally when they land up in the hospital care has to be taken very nicely, and thorough checkup should be done whether they should go for a normal delivery or they should go for a cesarean. That we have to evaluate it, and which it should not carry any risk factor or any danger to the patient or the baby. And the neonatologist simultaneously has to take care of the baby when the baby comes out. Before getting pregnant, one should visit a gynecologist to know about the details of the pregnancy, and if they have something, some existing disease like diabetes, hypertension, or family autoimmune disease or bleeding disorders, they should check with the gynecologist first, that if they get pregnant, how they should get checked up. So this communication with the doctor and touch with the doctor will also give a good result regarding the outcome, and we should advise accordingly properly the things to be done and what to do, what not to do.